Hello, everyone. Welcome. I'm just going to give everybody a few more minutes here to join. I did see somebody pop up real quick, but we'll give them maybe 1 or 2 more minutes, and then we will start. Oh, there you go. Perfect. Okay, so welcome, everyone. My name is Jasmine. I'm so excited to welcome you all to our Women's Health webinar. I am the Chief Culture Officer here at PHP. I'm super excited that you all are here and that we've been able to offer you ladies this webinar. For those of you who may not be familiar with PHP, Proactive Health and Performance Clinic, we are a rehabilitation and wellness clinic. We are a team of professionals who work together integratively to provide the best possible healthcare. Our team consists of physiotherapists, chiropractors, registered massage therapists, TCM acupuncturists, and psychotherapists. We believe in a whole body approach when it comes to healthcare and provide tools to help everyone bulletproof their health. I'm super excited to introduce our speakers. We have Nadia Kassam, who is our psychotherapist, Vanessa Otio, who is our acupuncturist, and Roopdeep Kaur, who is our registered physiotherapist and pelvic health specialist. Let's begin. We will be beginning with Nadia Kassam. So Nadia holds a Bachelor of Arts in Psychology and a Bachelor of Education from York University. She has also obtained a master's degree in counseling psychology from Yorkville University. Nadia recognizes the value of working from a holistic perspective. In her work, Nadia utilizes strength-based and patient-centered approaches to connect compassionately, build resilience, promote healing, and establish self-sufficiency. Before we go ahead, there will be a Q&A at the end, but feel free to ask any questions in the chat as we go along. Perfect. So Nadia, I'm just gonna pass it off to you here. Perfect.
Thank you so much, and welcome everyone. Tonight, just gonna get sorted here and we'll get started. All right, so thank you for that introduction. My name is Nadia Kassam, as it's been mentioned, and I'm going to be speaking to you tonight about mental health considerations for postpartum and pregnancy. And so, let's get right into it. So pregnancy and childbirth can be an exciting time, but for some women and families, this transition may be overwhelming. During this phase of life, women go through many changes. There's the biological and physical changes, such as our bodies changing, those hormonal changes. There's those psychological changes where we feel that excitement, changes in our mood, changes such as the increased tiredness or worry, and social changes, changes in our roles, developing new relationships, and our families growing. So what does this all mean? So I'd like to first start off by asking you a question, and this is going to be a true or false. So pregnancy is a time of increased healthcare, and so it protects women from mental health issues. What are your guys' thoughts? So if you can please answer in the chat. All right. So this is actually false. 20% of women will actually experience a mental health disorder during this time. And there's also this misconception that pregnancy, protects us against being experiencing mental health issues because we have access to more healthcare. So it really is important to understand what good healthcare is. And so women's health in Western medicine places great importance on those biological or physical aspects of our health, nutrition and exercise. However, research shows that it's just as important to put that care towards our psychological and social health. And when we do so, it actually improves our outcomes for both mom and baby. So it's really important to take this whole self-care approach, this whole self approach to our health, and this holistic approach. So I encourage you to consider the other areas of our health and not to be afraid of including psychotherapists as part of your healthcare plans to address those areas that are often missed. Okay, so another true and false. What do you guys think? So mental stress can impact pregnancy, fetal growth, and or the baby after it's born. What do you guys think? That'd be true or false? Okay, so this is actually true. So higher maternal stress is often associated with increased healthcare risks to both mom and baby. And when we're talking about mental health issues, actually, if they're left untreated, you can develop several different or experience several different risk factors. Here are some examples, and this is not by any means an exhaustive list. So let's now further take a look at some of the mental health disorders that women can experience during this time. Okay, so here are a few of the mental health conditions that impact women and families during prenatal, so during pregnancy or postpartum after having the baby. And for the sake of this webinar, I'll be speaking more about the common conditions that are experienced. So depression, anxiety, obsessive compulsive disorder, and birth trauma. I have included this slide, postpartum psychosis, but I just want to let you guys know that this is a really rare condition, really impacting about 0.1 to 0.2% of women. And we'll just mention that it is a mental health emergency, and seeking treatment immediately is really crucial. So we'll get right into it. So the first one is depression. So how many of you remember a time in your life where you felt deep sadness, an unbearable level of guilt, or where you blamed yourself, or maybe you noticed that you no longer enjoy the things that you once found enjoyable? All of these would be examples of some of the common symptoms of depression. And after giving birth, it's common for many women to, experience what's called the baby blues. This can be confusing because it has the very symptoms of depression. However, there's notable differences. With the baby blues is that this tends to last no more than a week, and it often goes away on its own. So this really leads women to, not seek treatment for this condition. However, it is known that about 10 to 20% of Canadian women will experience a more deeper, serious depression that lasts longer, and 8 to 10% of their partners can also develop postpartum depression. So it's not just the moms in this situation. Some individuals even report experiencing symptoms that last even years later, up to 3 years or more. So it's really important, if you're noticing that your symptoms are not going away, to seek that treatment. Depression can be very debilitating for families. I've worked with many individuals to help them better understand their depression, the negative thought patterns that keep them stuck, and finding healthy ways of coping. So next we'll move into anxiety. And we don't hear much about this during pregnancy or postpartum, but it actually occurs just as commonly as the depression does. And so, and it's often experienced in tandem with it. So anxiety occurs more frequently also amongst women. And so it's also a part of our normal experiences. Who hasn't had a little bit of anxiety, right? And so that's not what we're worried about here. It's more about, when it gets, it can be overwhelming. And so anxiety, remember, is a part of the parenthood journey. It's a part of being human. So how many of us can really relate to those worries about being a good parent, or thinking about how our life will change after the baby comes, and how our relationships might change? Or maybe we're worried about how will we juggle parenting and work. Unfortunately, if anyone has suffered from a miscarriage or experienced fertility issues, this can increase our anxiety, and we might struggle with it a little bit more than others. So what's happening really here? So there are hormonal changes that leave women to be more vulnerable to experience of anxiety. So this heightened anxiety that we feel. And also this stage of life is often, consists of this uncertainty, not knowing. And this really triggers those worrying thoughts of the unknown and gets us stuck in those what ifs. If you're noticing that feelings of panic or anxiousness or overwhelm are taking over your life, where it's really preventing you to maintain your regular routines, this can be an indication that it's time to reach out to and to help them through their anxieties by helping them to better understand their thought patterns, their feelings and behavior, and get better in tune with their bodies to help manage it. Mind-body practices like deep breathing, yoga, and acupuncture can all be helpful and are all offered through the clinic. Okay, so the next one that I want to speak about is obsessive compulsive disorder, or OCD. It is a type of anxiety disorder, and it can be experienced in pregnancy, after delivery, and even by our partners. OCD is similar to what you may have heard, and however, the difference here is that the symptoms really relate to the behaviors. The symptoms really relate to thoughts and behaviors that are focused on pregnancy and the baby. And so there's two aspects that we want to consider here. There's the obsessions and there's the compulsions. And so the obsessions are having these constant, unwanted, repetitive thoughts or images that relate to the baby or pregnancy being in danger or at risk. And the compulsions consist of doing things over and over again in order to reduce those obsessive fears. And so an example of this may be that, mom is having these fearful obsessions about, the baby falling sick or ill. And so they go into these ritualistic practices of heavy cleaning or keeping the baby away from others, where it really impacts their health and well-being. So these are some of the common symptoms that may be experienced. And what I will say about this is some moms will fear in this, when experiencing this condition, that they'll actually harm the child. And I want to let you know that that's actually not associated with this condition. Just because we're having a thought doesn't make it absolutely true, or that that the likelihood of that is that it's going to happen. In fact, in cases where OCD is experienced, the person is practicing these compulsions to really reduce those fears, right? And so there is little risk for that to actually occur where the baby will be harmed. The research also indicates that the experience of this is really low amongst mothers. About 3 to 5% is being reported. But OCD during this time can seriously impact a person's thoughts and behaviors, making it difficult to manage their daily routines. Psychotherapy can be an effective way to manage and control these symptoms. In more extreme cases, we might have to utilize medications, and it's always important to speak to your doctor to understand what is best suited for your situation. Okay, and the last one that I'd like to touch upon is birth trauma, and this relates to the stress that's experienced by the mother when in childbirth or during that experience of childbirth. And about 45% of new mothers report having a traumatic experience at childbirth. And this is according to a 2018 prenatal research study. Now, within Canada, it's difficult to really pinpoint this number because it often goes unacknowledged, undertreated, and undiagnosed. Part of the problem is and anxiety, and so the treatment may be ineffective. And so what makes a birth traumatic for women? And it's when they feel powerless through the birthing process, or perhaps they're very fearful, they experience a lot of pain, there's abuse associated with their delivery, or there's a lack of support. And research actually shows that in terms of birth trauma, the greatest indicator of experiencing this condition is actually linked back to lacking support from healthcare providers. And so it's really important for you to surround yourself with a good healthcare team that you're comfortable with. Another common belief is that trauma only shows up in our thoughts and emotions. However, this is not wholly true. And so people are very focused on dealing with those thoughts and emotions, thinking that they've resolved their trauma. However, trauma is also stored in our bodies, our relationships, and in our behaviors. And so this may not always be so obvious. It's really important to understand the different ways that trauma can show up in individuals, and also that our families and others around us can experience vicarious trauma. So even though they've not experienced the trauma, still be affected by it. Deciding to speak out about the trauma and address it using therapy can be very effective. It helps us to connect with others empower us over that trauma and never, and no longer allow it to, take ownership, take control of our life. Okay, and so what I want to just lastly say about all of these different conditions is that these are generally temporary, and seeking treatment with a professional can really help you to feel better sooner. I encourage you to, come into the clinic if you're experiencing any of these conditions, if you're wanting more information. You don't need to suffer alone. Know that it's not your fault and you're not to blame. I'd love the opportunity to meet with you and see how we can best work together. And so although there's been many changes over the last few years of how people seek help for their mental health issues, there's still a lot of stigma, especially for women, and being able to report psychological symptoms during this time. Mothers may feel fearful to speak up because it could lead to, showing that they're unfit moms or taking their children away. Or they may just not report symptoms because they believe that that's how this experience is supposed to be. Childhood and pregnancy is often, childbirth and pregnancy is often glamorized, and women are supposed to know, just like be aware and naturally take up these roles, and know how to respond to it. And when we're not able to achieve this, and our expectations don't match our realities, we can feel down and ashamed. It can leave us feeling guilty or having harsh judgments towards ourselves and setting unrealistic standards. And we may not even be realizing how this is all affecting us. So let's be really real. Growing another human and bringing them into this world is hard work, right? It's not always easy. And we need to hold some space to really acknowledge that. I want to encourage you to remember to be kind to yourself, no matter what your journey is, what the state of your mental health is, and to really hold space to accept that just like other stages in life, pregnancy and postpartums will come with its ups and downs as well. So just a few things that I would hope that you remember. So it's important for you to learn ways to prioritize your health from a holistic perspective, and to consider your mental health and your needs, which may be different from person to person. I also want to hope that you will remember to trust and honor and love yourself. That's the first step for being able to be the best for anybody else around us, like a new baby. Expectant moms and new moms are often very baby focused, and so maybe a little activity that you can engage in or try. We're often creating these gift registries for our baby and trying to set up home for the baby to come home. And I would encourage you to create a self-care mommy list or a mommy registry for yourself, making a list of the things that you can do to take care of yourself throughout those chaotic moments and while on that journey of motherhood and parenthood. There's also a lot of different community resources, and if you're needing help or assistance, please feel free to email the clinic. We'll be happy to help. And lastly, I just want to leave you with a quote. And so, a baby's first day of being human is also your first day of being a parent. And so, can we really let go of being perfect? Can we really let go of doing everything right? And can we really adapt that beginner's mindset, being kinder to ourselves and learning to adjust through the changes? I thank you for your time. That's all.
Amazing. Thank you so much, Nadia. I think that's beautiful, that last quote there, just kind of remembering that everyone has their own journey. And I think that the more people share their stories, the easier it becomes. You kind of realize that everybody has their own journey as well. Perfect. Amazing. I also like the idea of a mommy registry. Get something nice for yourself. Perfect. And then our next presenter will be Vanessa Otio. Vanessa began her career in the dental field, but it wasn't until she developed her own health issues that she has begun to look into alternative healing. She studied and became a personal trainer and a fitness instructor and taught at a local gym. She then decided to pursue holistic nutrition, where she was introduced to Chinese medicine. She attended John and Jenny Traditional Chinese Medicine College for 4 years and became an acupuncturist and TCM practitioner. She also got certified in cosmetic acupuncture and Reiki. She's currently working in clinic, teaching at an acupuncture college, and is a board member of TCMAC, an acupuncture association. Hi, Vanessa, welcome.
Thank you so much, Jasmine.
Awesome.
Let me just.
I'm going to hand it over to you now, Vanessa.
Okay. Okay. So good evening, everybody. Thanks for attending our webinar. Nadia, I really enjoyed your presentation. I learned a lot of really interesting things. So my name is Vanessa, and I'm a registered acupuncturist and traditional Chinese medicine practitioner, as Jasmine mentioned. And I'm going to talk about acupuncture and traditional Chinese medicine in terms of, gynecology. Because a lot of times, we typically think, acupuncture is really good for pain conditions, but it's really good for all kinds of different things. So you'll learn about that today. So firstly, Chinese medicine is one of the oldest and most commonly used medical procedures in the world. It's actually thousands of years old, and it treats many, many different conditions. It's used in many different countries. And in fact, after I graduated, I treated my grandmother, and I did some cupping on her, which I'll talk about a little bit later. But she said that in her village in Greece, there was a medicine man that would come around and he would do cupping and give them herbs. So I just thought that was like really, really interesting. So Chinese medicine is based on determining a patient's pattern of disharmony and maintaining balance. So emphasis is mainly placed on disease prevention and health maintenance. So we don't need any medical tests in order to treat patients. We are simply looking at the patient, asking them questions, palpating their areas of discomfort. We're using the tongue and pulse to help aid in our diagnosis. So this can be really great for patients where Western medicine can't really figure out what's bothering them. So we use many different methods. The most commonly seen one would be acupuncture, but I also do cupping, herbal therapy, gua sha, which I'll explain in a little bit, tuina, which is Chinese acupuncture-based massage, lifestyle, and dietary therapy. So I'm going to show you a few pictures on what that stuff is shortly. So firstly, who has tried acupuncture before? If you have, you can, put it in the chat. But acupuncture here, it involves stimulating key points on the body. They're called acupuncture points or acupoints. And we're using thin, single-use sterile needles. So let me just see the chat, see. Okay, lots of people have tried it before. That's great. So here, when we apply the acupuncture needles, this essentially is going to enhance the body's natural healing ability by allowing more blood flow. It's also going to help by stimulating our endorphins. That's our, feel-good chemicals. It's going to help bring in more anti-inflammatory cells, block pain signals, help with circulation. Research has found that many acupoints actually correlate to deep-seated nerves, which trigger the release of endorphins and other brain chemicals when activated by the needles. So acupuncture can treat many conditions that involve like actual pain, such as neck, shoulder, back pain, but it also can help with digestive complaints such as IBS, constipation, acid reflux, headaches, insomnia, anxiety, and it's also very effective for gynecological conditions, which we're going to talk about today. So let me move to the next slide. So here's a picture of acupuncture needle. So in case you've never had acupuncture before and you're afraid of it, this is showing you how small, how fine the needles actually are. So if we look at the top, here's a picture of a matchstick. a medical syringe, a sewing needle, and at the bottom, that's an acupuncture needle. So you can actually put in probably about 20 acupuncture needles into the head of a medical syringe. That's how fine they are. And typically, I would say there's very, very little pain. And if there's anything, it may feel like a mosquito bite type of sensation. So even for me, the first time I went to have acupuncture, you know, I was very, very nervous. And I had at the time an issue with my back. And ultimately, that's what helped me. But after my first session, I felt very, you know, comfortable, happy with the results that I actually got into the field, right? Okay. So here's a picture of gua sha. So this is called scraping. That's and essentially we're using gua sha for cosmetic purposes to help increase blood flow, to help with pain conditions. That's typically where I'll use that. On the right, this is our tuina, which is our acupuncture-based massage. Okay, on the next slide, this is a picture of cupping. So this again is really good if you catch a cold. If you catch it enough, like early enough, you can actually use cupping to get better right away or prevent the cold. It's good for pain conditions, circulation. Essentially, it's kind of like a reverse massage. So instead of us, pushing down, we're lifting up, allowing more space for circulation. And then the picture on the right, I thought I would include this, but essentially this is ear acupuncture, and we can use this for any condition, even gynecological ones, because you can actually take all the points of the body and it's actually on the ear. So it's really quite an interesting thing to use. A lot of patients really, they like it, they see the benefits. A lot of times I'll use ear points to help treat any issues with infertility, anxiety, depression, all kinds of things. Has anyone tried, cupping or gua sha, tuina, any of those before? You can put that in the chat and let me know. Some people, they may be new things you've never heard about, and maybe worthwhile coming to the clinic and trying it out. So here I have the benefits of acupuncture for women's problems. So firstly, we can use it to help for infertility. So here it can actually help to regulate the menstrual cycle. It can improve the general health of both patients. And that's something that usually there's a lot of emphasis placed on women, but really in Chinese medicine, we want both the mother and the father to come in for treatment to improve their general health. So let me just take a look. Lots of people have tried cupping. That's great. So acupuncture can help provide pain relief during and after childbirth, and as a strategy for decreasing pain medications. It can actually help with morning sickness, nausea, vomiting, headaches caused by hormonal changes. And it even can help with decreased milk production or insufficient lactation. It can also help with postpartum abdominal pain, depression, and dizziness. I'm just going to check the chat, especially. Yeah, really great, Noreen. Okay. So acupuncture and infertility and pregnancy. So acupuncture as a treatment for infertility shows great results in both men and women. In Chinese medicine, like I said, it's beneficial to treat both the husband and the wife, or the male and the female. Acupuncture can be considered a successful treatment in restoring fertility in patients by improving the sperm quality, ovary function, and by balancing the endocrine system and the hormones. So for one thing, acupuncture promotes relaxation, decreases stress levels, regulates the menstrual cycle, and improves blood flow to the uterus, all which will help with infertility. Acupuncture may also help conditions such as polycystic ovarian syndrome and endometriosis. These are things we're hearing more and more about nowadays. Here's an acupuncture point. This one's really good for infertility. It's called Zigong. It means the palace of the child. So this is one that can help the uterus and the ovaries and helps to regulate the energy in the body. So here we're talking about the acupuncture relating to the different trimesters. So in the first trimester, acupuncture can relieve nausea and improve our mood, as well as boost energy and relieve constipation. During the second trimester, clinical studies have shown that acupuncture is a safe way to relieve common aches and pains such as back pain, as well as help improve sleep. And then during the third trimester, it's a great way to prepare your body for labor. It can also encourage labor for clients past their due date. It's also an effective way to help flip a baby when it's breached. So that's something that I'm sure not a lot of you have heard about. So we'll talk about that shortly. And then we have to talk actually about acupuncture postpartum and in the fourth trimester. So not a lot of people have probably heard of the fourth trimester, but this is a transitional period between birth and 12 weeks postpartum, during which the baby is adjusting to the world and the mother is adjusting to her baby. While there's often much to be celebrated, it can be a physically and mentally taxing time for parents and a major developmental change for the baby. So during the postpartum and fourth trimester, we can increase energy, calm postpartum anxiety, relieve postpartum depression, promote lactation for breastfeeding, ease urinary incontinence, and ease the reintroduction of exercise and movement. So this slide here, I put an example of what they have in China. It's called the Golden Month. And it's actually not 30 days, it's actually 40 days postnatal period, when essentially they want the mom to rest, recover, and regain their health. Because during the birth process, the mom loses a lot of energy, which we call qi, and blood, and that can lead to disease. For instance, losing too much blood during the birth of the baby can lead to postnatal depression. So that's a cause of that, according to traditional Chinese medicine. Also, the period after the birth, the mother is more susceptible to disease. They feel that she's more essentially open to getting sick at that period of time. So it's believed that if she really rest and recover, then she can actually heal illnesses that she had prior to giving birth. But if she doesn't and she consumes too much energy, diseases that can happen after that period of time and never go away. So it's kind of an interesting concept to think of, but I think it's a good thing. It's really, promoting the mom's recovery and restoration of her health. Morning sickness and acupuncture. So acupuncture may be helpful for women who suffer from severe nausea or vomiting during pregnancies, especially if they want to avoid medication as a remedy. In the 2013 American College of Obstetricians and Gynecologists review, they found that acupuncture was effective for relieving nausea associated with analgesia or pain relief from C-sections. So it has many, many uses for relieving symptoms, even in a hospital setting. So an example of an acupuncture point is PC6. That's really good to help with morning sickness. So don't worry about the names. I'm going to explain this to you. So if we look here, if you take your hand and you put 2 fingers after your wrist crease, the center there between the 2 tendons, that's going to be PC6. And if you look below this picture, this is like a seasickness bracelet. This is a good example how, even Western medicine is kind of acknowledging acupuncture as being effective.
Yeah, I think that on that point, Vanessa, that Western medicine it's coming up a lot more. Like you're hearing about gua sha and everything a lot more as well. I have a quick question for you. Gua sha and like cupping is more prominent in stores as well right now. So what's the difference between what you provide and what's in store?
What I provide and what you can find in the store?
Yeah, exactly.
Okay, so I think it's the way that people are using it. You need to use everything in the proper way to get the best results and, you know, not cause any harm. So I think that would probably be key. I think that's the main thing there, knowing when to use the products, how to use the products. You know, every person, every patient is going to require a different type of treatment. Everyone's going to have different patterns. So it's important to figure out that aspect, because we can, you know, if we do too much of something, it may be not good. Some things are better for other patients. So it's important to come in and, you know, learn what's the best for you. And then from there, I can, you know, help to teach, you know, the patients how to do some home care.
Amazing. Perfect.
So here I'm talking about acupuncture to help initiate labor. This is something that I don't think a lot of us know about, but it's very, very interesting and very effective. So acupuncture is an ancient form of Chinese medicine that's persisted this day due to its effective nature. Like I said, it's a few thousand years old, and it's based on the idea of improving natural processes through unblocking energy and relieving stagnant energy throughout the body. So this is extremely beneficial to help induce labor, because essentially there can be some blockages not allowing the baby to be born, right? So this is going to help increase the energy flow, bring more of a descending descending function or able to promote labor. So as long as the mother and the baby are healthy and they're carried to full term, then you can use the following points in order to initiate labor. So I'll show you some common points. So here's one on the hand between the thumb and the index finger. This is a really good point for headaches, but it's also really good for issues with labor, inducing the labor. And it's also really good to help for painful periods. So it's got many, many functions in terms of gynecology, but also anything in the head and face. So you may, you know, hear about people pressing this point when they have headaches, for instance. The next one here, this is another really good point. It's also really good to regulate the menstruation and help promote labor, but it's also good to build the blood in the body, which is going to help with depression. So you can see, like, some of the points have, you know, many, many different indications. All right, this one here is another point that helps to promote labor, but it also helps with back pain. So, you know, it's a really good point to use, especially in pregnancy related back pain. And this point here on the end of the little toe, this one here actually helps to turn the fetus and facilitate labor. So especially if someone is, their baby is in breech position, we can use this point to help flip the baby. This point here on the clavicle is really good to bring down the energy. So this is going to help to initiate labor as well. And this one as well here on the shoulder is another good one to help promote the descent of the baby and the placenta. So very interesting things to see. This is also another point that's really good if you have shoulder pain, but the points are very, very versatile. Okay, so now I'm going to talk about postpartum conditions. So this is the point we talked about that helps with breech baby. And with this one here, we're actually going to do something called Moxibustion. And this is using an ancient technique of burning this herb called Artemisia vulgaris, or mugwort, to stimulate the circulation of qi and blood. So ancient clinicians believed that moxa was effective in treating a variety of disorders, and regular use could prevent illness. Here we see a picture of mugwort in a cigar-like stick, but we can also use Moxibustion on top of needles as well. There's many different ways that we can use it on top of ginger as well. That's another example for any type of indigestion, stomach cramps, that type of thing. So here we're going to kind of encircle the baby toe with the Moxibustion stick on that point we mentioned earlier. They say that breech presentation occurs in about 2 to 4% of pregnant women. And here we would initiate this type of treatment at the 34th week of gestation. That's the optimal time to carry out this technique. Of course, we would have to be working alongside the medical doctor and making sure that the mother is having regular ultrasounds. The patients can even do this technique at home. So usually here we would do Moxibustion on both feet for 15 minutes each time, and once a day for 10 days total, or according to what the ultrasound is saying. Okay, the next slide, we're talking about insufficient lactation. So the hormones responsible for lactation are oxytocin and prolactin, which are released in normal conditions and make the breast produce milk. However, oxytocin is inhibited by adrenaline, and that's our stress hormones, right? So adrenaline and oxytocin don't get along. So here, sometimes a new mother can be influenced by the remarks of other people. Even though they mean well, they may make her become less confident, and then she's not trusting her own body. And then that can increase the stress hormones and then decrease the milk production. Can anybody relate to this? If you do, just put yes in the chat if you've experienced something along those lines. So acupuncture can be an effective treatment to regulate the body and significantly boost lactation. There are many randomized controlled clinical trials demonstrating a successful increase of breast milk secretion and the increase of prolactin levels in mothers that received acupuncture after delivering a baby. All right.
Super interesting that you're saying that acupuncture helps with that, because I feel like breastfeeding is very stressful for a lot of new moms. There's a lot of pressure on it. Obviously, there's like so many different forms of feeding your child, but it's really interesting to know that there's other forms of help that people can reach out to.
And if you think about it, like acupuncture, there's no medication involved. It's very, very safe. There's no risk of anything being inside the breast milk that can harm the baby. So it's a very natural, effective way to deal with it.
I didn't even think of that part, but yeah, that's actually very, very accurate. That's really interesting.
All right, acupuncture for postpartum depression. So I already talked about it a little bit, but one of the causes here is not enough blood, because the blood loss during the labor. So many clinical studies have shown that acupuncture is significantly effective in treating postpartum depression. It promotes relaxation and reduces stress. Acupuncture calms the nervous system as well as the mind and body by lowering the blood pressure, promoting healthy circulation, and mitigating the release of stress hormones. We can heal from the physical birthing process. Being a beautifully intense experience, women use a large amount of blood and chi, or energy, to both create and birth the child. It can also restore balance to the body. Once we look at the underlying patterns and root cause of the postpartum depression, we can create a unique diagnosis for the patient, thus allowing us to lessen the root symptoms and allowing the body to heal and prepare for parenthood. And it's also time for self-care. So acupuncture allows for time to implement self-care. Restoring homeostasis or balance to the body is essential in a new mother's journey and for her well-being. And that's kind of what Nadia was saying. It's important for the mom to take time to, look after her well-being and heal herself and relax her mind. And that's the end. So I appreciate everyone taking, their time to listen to my presentation. And if you'd like to book an appointment with me, you can go online or you can call the clinic, and I'll be available for any further questions at the end of the presentation.
Thank you so much, Vanessa. That was super interesting. I didn't even know that there was a 4th trimester, first of all, which is really interesting, because I feel like as soon as the baby's born, it's like, all right, that's it. Go on with your life. But I think it's really interesting that especially with the golden month that you mentioned, there's another 30 or 40 days that a new mom should be taking for herself. All right, everybody, let's move on to our 3rd and final presenter, Roop. Roop holds a Master's of Science degree in Physiotherapy from the University of East London in the UK, and a Bachelor of Physiotherapy degree from GNDU from India. She is in good standing with the College of Physiotherapists of Ontario and is licensed to perform internal pelvic exams. She is also a member of the Canadian Physiotherapy Association and the Women's Health Division of CPA. So here we go. Let's give it up for Roop. She's our registered physiotherapist and our pelvic health specialist. Hey, Roop.
Hi, everyone. Welcome, everyone. Thanks for joining. I really enjoyed Vanessa and Nadia's presentation. I'm just going to set it up for mine just in a second. Okay, so today we will be talking about core and pelvic health in pregnancy, birth, and postpartum. First of all, we'll talk about what are the core muscles. So I'll be using this balloon just to kind of like show what we're talking about, just making sure that everyone can see me. Okay, so core muscles, whenever we think about core muscles, we normally just think about abdominals or low back muscles. So here we see on front, we have abdominals, and then on the back, we have low back muscles. We forget about the diaphragm, that's right at the top, and the pelvic floor, that's right at the bottom. So they all four together, they form the core. And when we talk about pelvic floor, we normally think the pelvic floor only consists of muscles. It does have other connective tissue layers. So I'll be using this model here just for a bit of visualization so you get an idea. So it does have vulva on the top, that's connective tissue layer, and vagina, that's the canal right at the top. And this is the perineal body. So I'll be talking about this in terms of tears and stuff. This is the area in between two holes where a lot of structures attach. And there are 3 layers of muscles in the pelvic floor. Now, pelvic floor is unique in its own ways. It has autonomic. That means it's working on its own. So sometimes you don't even have to think about the pelvic floor. It's helping to prevent the leakage of urine, doing its function. But if you want to contract those muscles, you can actually voluntarily contract those muscles. These are the 5 important functions of pelvic floor. Support, it really helps to support all the organs like the bladder, uterus, bowels. Sphincter control, it helps to prevent the leakage of urine and feces. Sexual function, stability, it plays an important role in core stability. Sump pump, that means it has a lot of lymphatics in the pelvic area that helps with the circulation. You must have heard like most of women in pregnancy, they get like a lot of swelling in the legs. So mostly there can be congestion in the pelvic floor. That's where it's losing its sump pump function as well. Now, this is one of my favorite videos. It was a functional MRI done on men and women. So they were just normally breathing. And if you look at this video, when they were inhaling and exhaling, the pelvic floor was responding to that. In the second video, we can see again, when someone inhales and exhales, the pelvic floor is responding to that. Now, this is what normally happens in our body. Because of many reasons, this function can get impaired and people can have pelvic floor dysfunctions. So I want to say it out loud, you do not have to hold your abdominals or hold your core muscles all the time because you're kind of impairing with this function because your belly cannot expand with every inhale you take.
Have you guys heard about the core breathing? Okay, so we will be doing like a little practice here. I'll do that with you. So I'll just stop sharing my screen for a second. So what I want you to do is like, just take like a big inhale. Just take a moment to settle yourself and take a big inhale. And then exhale. Pay attention what's happening to your body. You may be noticing a lot of chest rise. You may be noticing a lot of belly rise. It may differ from person to person. Now, what I want you to do is like, try contracting your pelvic floor muscles. Whatever you understand from that, try contracting the muscles that are down there. Just pay attention what happened. You may have felt you're just kind of like lifting your bum off from the chair. You may be contracting your core muscles. So it differs from person to person. Everyone has like a different strategy of doing these exercises. Now we are going to try a bit more different way. So I'm just going to adjust my screen. So what I want you to do is put your one hand on the chest and one hand on the belly. So now take like a big inhale. Try keeping the hand on the chest quiet and try breathing into your belly with the inhale. And then exhale. Now with the second breath, what I want you to do is like inhale first into the belly. And while exhaling, try picking up like a blueberry using your vaginal muscles. So this exercise is called core breathing and traditionally also known as Kegel. So I'm just going to go back to our screen, just making sure you all can still see the screen. Yeah. Okay. So this is one of the most common questions that I'm asked in the clinic. Does everyone need to perform Kegels? My answer is no. Kegels are contraindicated in many cases. So I highly recommend reach out to your healthcare provider before you start performing these exercises. Now let's talk about some changes that happen in pregnancy. There can be postural changes, there can be changes in the breathing, there can be changes in the pelvic floor. These all happen because you're growing like a little baby inside you. So there's extra fluid gain and weight of the baby that can cause these changes. Have you guys heard about diastasis recti before? So mostly in the clinic, when we talk about diastasis recti, women find it very scary. It can happen in pregnancy. So I'll explain in a bit what actually diastasis recti is. It is also known as mommy tummy or ab separation. These are the terms when you Google, you may come across these terms. So what happens in pregnancy, so when we look at like these abdominal muscles, we have 6 back muscles on the side. There's tissue in between these abdominal muscles that usually tends. It is actually not a separation. If it is a separation, that would be considered hernia, and there's a different kind of management for that. Usually that tissue is thin, and that's what's called diastasis recti. Yes, we know the thin tissue is vulnerable, so that's why there are strategies we want to learn to manage diastasis recti in pregnancy and postpartum. Every woman in their pregnancy will get diastasis recti to a certain degree. What research tells us, 100% of women will get diastasis recti by 35 weeks of their pregnancy. And there are all other muscles contributing to diastasis recti as well, like all other abdominals, rectus, obliques, everything. So these are the few myths associated with diastasis recti. If someone says we can prevent diastasis recti, that's wrong. You cannot prevent it. It's a natural adaptation that occurs during pregnancy. If someone says these are the 5 exercises that will heal your diastasis recti, that's wrong. Unfortunately, nothing like that exists. It is not about an exercise. It is about how you perform an exercise that will help you with diastasis recti. And then sometimes we think there's nothing that can be done for diastasis recti. I would say that's wrong too. Maybe you did not come across the right strategies. There are a lot of things that can be used to manage the diastasis recti.
So now, how to measure diastasis recti? Now, how would I know that if I have diastasis recti? First way, if you are in the postpartum period, you can measure diastasis recti with the distance in between your rectus muscles. So what you can do is, like, when you're lying down or standing, you just palpate right here in the middle, and you just put your hand either this way or this way. Feel if there's a gap between, or you feel like there's a distance between those two muscle borders. Now, distance does not matter, but it just tells us that you do have diastasis recti. I highly recommend seeing a professional, a pelvic physiotherapist. The person can assess tension in the muscles and help you with, like, the management. The second way, if someone is pregnant and you're doing some movements, you notice, like, right in the midline, you notice like a bit of doming or coning, and that can also tell you that you do have the diastasis recti. So normally, another question I'm usually asked is, like, can I do sit-ups with diastasis recti? My answer is, why not? You can learn how to manage your core and your core muscles, and you can do sit-ups. Usually in diastasis, there's no cookie cutter approach, unfortunately. There's an individualized approach. If there are 3 women, everyone may have diastasis recti to a different degree, and you can learn the strategies and be on your own and manage it. Now we'll talk about the pelvic girdle pain. This is also very, very common in pregnancy and postpartum period. Pubic symphysis pain. Usually people have pain around the front of the pelvis where pubic bones join, or they can have hip pain on the sides. They can have low back pain in this area, or they can have sacroiliac joint pain. That's like these 2 joints on the side. It's very, very common in pregnancy. How many of you have had any kind of pelvic girdle pain? Okay. Sorry, just give me 1 second, guys. Technology, sorry, 1 second.
Technology, you love it, and sometimes
Yeah.
that's it.
Just give me 1 second. Okay, let me know if you guys can still, you can see the screen. Can you guys see the slides again?
We're good
Okay.
to go. By the way,
Perfect.
I love it. I love the touching the balloon. I hope it comes back. It's very nice to have a fun visual there.
Here we go. Okay, so we are gonna pick just where we left. So there is a myth that's associated with pain in pregnancy. You may have heard, oh, that's like normal in pregnancy. You will be fine once you give birth to the baby. That's okay, just suck it up. We hear all the time, or even by medical doctors, sometimes we're told, oh, that's okay, that's totally normal. There's a lot of things that you can do to manage this pain in pregnancy and improve your quality of life. Pelvic physiotherapy is the gold standard. So you definitely can learn what you can do, what are the do's and don'ts, and so you can navigate your pregnancy very easily. So what are the benefits of pelvic physiotherapy in pregnancy? You can have pain relief, treat diastasis recti, prevent incontinence and prolapse, prepare for smooth birth, prevent tearing and episiotomies. We'll be talking about them in a while. And you can learn about the early postpartum rehab. You can also learn about the birth preparation in pelvic physio appointments. Sorry, guys, I'm like a little bit under the weather. It's not COVID. Okay, so you can learn about the benefits of upright positions during labor. You do not have to lie down on your backs with your legs up on stirrup to give birth to a baby. You can be on your hands and knees. You can be the sideline. Even women who do opt to take epidural, you can be in the sideline position to give birth to your baby. Now, why does that matter? If you are lying down on your back, chances are your tailbone and sacrum is not free. So that reduces the room for the baby here if you're giving a vaginal birth. So that's why we want to opt for sacrum-free positions. It can have a lot of benefits, like it can shorten your first stage of labor, lower chances of C-section, decreased need of epidural, and babies are less likely to be admitted to NICU. Are you guys familiar with these pushing methods? So I'll be going one by one. Valsalva pushing. Yes.
How is better than person you can push? That's all.
Yeah. So Valsalva pushing is when a woman is asked to take like a big deep breath, and she's asked to push down or bear down. Now, pushing down can mean different things to different people. If someone tells me to push down, sometimes I may know, okay, am I pushing through my bum? What am I doing? Am I pushing with my full force? So it can be very confusing. But in the past, that's how women were instructed. Like you take a big deep breath and you really bear down with all of your force. Now, what we know, this can lead to a lot of tearing, unfortunately. Now, second method is spontaneous pushing. That is more self-directed. That's where we want to be. This is usually like a woman on her own using different techniques, either open glottis, vocalization techniques, breathing techniques, kind of follows her body's signs and pushes accordingly. Directed pushing is like when a healthcare practitioner or your birth support person or a doula tells you to do the push at a certain time with certain intensity. Now, Valsalva pushing and directed pushing, yes, can be medically sometimes indicated, but mostly we want to be in the category of spontaneous pushing to avoid most of birth complications. So now we'll be talking about some of the assisted birth techniques. Induction, forceps, vacuum, episiotomy, and cesarean section. So forceps and vacuum are kind of like some tools that are used during the birth process. Episiotomy, where they make a cut, like an incision on the pelvic floor to help with the birth of the baby. So now, why does this matter? It is important for you to know about these so you can advocate for yourself. Sometimes I'm talking to people in the room, like during the appointments, if you know that they'll be using one of the assisted birth techniques, you can opt for a vacuum where indicated versus forceps, because we know there are more complications with forceps. So this really empowers you and you can advocate for yourself. Now, episiotomies and tears. In the past, episiotomies were done very routinely. Thankfully, they are not practiced routinely anymore. They can be used where it's medically indicated. Now, what if you get one? If you have got one episiotomy, it's very important to check with your pelvic physiotherapist, because you can manage that scar. You can prevent a lot of pelvic floor dysfunctions that can learn from scarring in the pelvic floor area. Now, what can we do to prevent episiotomies or tears? Normally, I teach women prenatal massage and prenatal stretching techniques that they can learn while they're pregnant to prevent the tears and episiotomies. And there's a very good degree of evidence to support that you can actually prevent these things. Now, exercises in pregnancy. In the past, it was said like you should rest in pregnancy. Rest is the best for the health of baby and mother. You should avoid heavier strenuous exercises. But what we know now is like you should actually be exercising throughout the pregnancy, because your body will be having the increased demands of taking care of the baby. You'll be pushing the stroller in the postpartum period. So it is very important for you to be strong, and there's so many health benefits of it. This is the Canadian recommendation, at least 150 minutes of moderate intensity physical activity each week, so that you can actually have a healthy pregnancy. And exercise can be in any form: yoga, strength training, walking, Pilates. So you can do whatever you enjoy. Now, what are the benefits of pelvic physiotherapy in the postpartum period? It can help you to restore your core muscles, treat urinary leakage, treat pelvic pain, treat pelvic organ prolapse. Pelvic organ prolapse is like sometimes during the pregnancy, birth, or in the postpartum period, the organs that your pelvic floor was supporting, like your bladder, uterus, or bowel, sometimes they can be distant into the pelvic floor area, and it can be it can really affect quality of life. And that's something that can be dealt with in the early postpartum period. And you can learn to get back to the exercises safely. It is very, very important to start timely postpartum rehab. It is never too late. Even if you're 6 weeks postpartum or you're 6 months postpartum, it's never too late. You should seek help. Scar management. So cesarean section is one of the most common surgeries in North America. We know scars can change the tension lines. Scars can change how the muscles are working. So it's very important to desensitize the scars and work on cesarean scars. I always give an example. When someone goes for like a knee surgery, for example, a knee replacement surgery, you're given a big handout by your orthopedic surgeon that you should follow with a physiotherapist. You should follow this rehab for 3 months and recovery, and you're given all those instructions. Now, some of you can relate. If you have had a cesarean section, you are not given that much of information, unfortunately. So it's very, very important to seek help. And you can learn a lot of strategies actually during the pregnancy to manage this period and like to actually navigate your postpartum period easily if you had a cesarean section. Now, postpartum exercise can vary based on multiple factors. Few of them are like, if you had a vaginal birth, I may be giving you different kind of exercises. If you had a cesarean section, it may be different. Or it may also depend upon your pre-pregnancy or pregnancy fitness levels. Okay, that's everything for today. If you have any questions, feel free to type them in the chat or please ask them.
Amazing. Thank you so much, Roop. That was great. I hope you guys can all hear me. My headphones are a little wonky here. So we're actually going to open up for our Q&A session now. So if any of you have any questions that you would like to ask, feel free to just place those in the chat. I do want to thank all three of you ladies. All that information was great. I feel like there's a lot to take in here. So again, if any of you have any questions that have come up in the past hour, feel free to type those in the chat. I have a question here. So Roop, so obviously this webinar is for women who are thinking about conceiving or people who are already expecting. When is the best time to start pelvic health appointments? So is there a best time? Can they start whenever? Should they start before even conceiving? And what would you recommend there?
That's a great question, Jasmine, actually. And so I recommend whenever. Even before conceiving, if you do see a pelvic physiotherapist, you really get a good baseline information about your pelvic floor. You can learn those strategies. What I personally find, women in their first trimester are you're very cautious. So sometimes you do not end up seeing a pelvic physiotherapist at that time, and that can be a personal choice. I highly respect that. So if you have seen someone before, you can actually continue a lot of stuff during that time. But if someone is pregnant, and honestly, you can start even at like 6 weeks, 7 weeks, anytime you can see like a pelvic physiotherapist.
Amazing. That's good to know. And then we have a question here for Nadia. How would you help suggest for someone to get help if they are showing symptoms of postpartum depression? Like if in terms of if it's a friend.
Great question, and thank you for asking. So it's really important for us to understand what's happening, and I think if it's for a friend, you know, letting them know what you're noticing and helping them to kind of navigate that, to understanding what depression is. A lot of the times I'll tell families to really know the condition, so learn about it, get familiar with it, because that really is our first plan to be able to understand and how to treat it. If they're really suffering from issues where you're seeing that it's really impacting their day-to-day function, like, you know, where we're not able to live normal and do normal routine things, that's a good indication that, you know, it's a good idea to seek help. Now, sometimes it may be to the point where it's very severe, and I think the first plan of action would be to have the conversations with your family doctor, seek out what's available around you, so that this way you're able to connect. With psychotherapy, there's no referrals that are needed, so you can actually speak to somebody, book a consultation, and, you know, get some be able to get some suggestions in terms of how you guys can work together. It's important to understand what's important for you and how to best manage that based on what you're experiencing.
Amazing. And I think it's important to, like, when people are feeling things themselves, when they're going through it, it's just to kind of know when they need to seek help as well, and that it's okay. Like, I feel like there's no, you know, there's no right or wrong there. There's always oh, she said thank you. So there's always room there to reach out for help as well.
It's kind of tricky too, because we can't force anybody to receive help, but we can always support them. And sometimes that's the most thing that we can offer them, and we want to offer that.
Yeah. For sure. Amazing. Perfect. Any other questions? I also, so and Noreen's asking for Nadia, what suggestions would you give the partner, like the father of a new mom, for how they can support her mental health?
So just to clarify, are we asking about how the father can help support the new mom? Is that what the question is asking?
Yeah.
So it's important to talk about, what your expectations are. I think communication is really important in this period of time, not only just in relationships in general. It's really important to really understand it around chaos too. And so, with some of the women that I've worked with, being able to really speak to your partner about what your needs are, being able to effectively communicate that, and sitting actually with yourself to understand what is, what works for me, and that, because at the end of the day, it's important for us to understand that, so that we're able to then utilize our partners for support, right? And then being able to then make sure that our partners are understanding what we mean, right? By, what types of supports we look for. Often women will say that, I thought, like, after having a baby, I would want my mom to be there, or I'd want certain things to be there, and being flexible too, knowing that that can change as we experience these things, and having those open conversations with our support people.
Amazing. Yeah, communication is always key. I have an additional question. So this could actually go for Vanessa or Nadia, or whoever would like to answer. How bad is stress for conceiving? Is this a major barrier to being able to have kids?
Okay, I'll just quickly answer, sorry. So something that Western medicine rarely looks at is emotions and causes of disease. So there's many causes from that, but essentially when we're under a lot of stress in Chinese medicine, it actually tenses up the body and it kind of stops the flow of energy and blood. So like I was kind of mentioning before, that can potentially make someone have a difficult time in conceiving. In a Western medical perspective, obviously our stress hormones are going to be higher, and it's going to kind of throw our hormones out of whack. So, for many different health conditions, we can definitely look at stress, even grief, like all kinds of emotions will lead to different types of disease.
Perfect, thank you. Vanessa, we have another one here for you. Can acupuncture help during the first trimester? I know physio and massage sometimes isn't allowed.
Yeah, it's a really good time. You can definitely do acupuncture during the first trimester. Like I said before, just to kind of help with our general health, kind of to, bring down our stress hormones, help with nausea, vomiting, all those types of conditions. For sure, it's really good. And there's no side effects to that. A lot of times I'll even use it when someone is going to have in vitro fertilization, like those types of things. I work alongside the patients with that. So they have to let me know when they're going to have a transfer and those kind of things. So definitely we could do acupuncture there.
That's so interesting. So like how long do typical, like obviously everyone's different, but would that treatment process be longer? Just because you're using a more natural approach to it?
Yeah, so if it's in order to, for infertility purposes, we'd want to, see the patient twice a week for that, in order to get pregnant. And then in order to have the transfer, we'd usually do the day before and the day after the transfer. That's another kind of way we would do it. To regulate the menstrual cycle just itself, let's say they have irregular periods, then usually I would see the patient once a week type of thing.
Perfect. Amazing. Any other questions? I'm going to give it a couple of seconds here. Okay. So if anybody does have any additional questions, feel free to reach out to the clinic. There is our email there is info@PHP Clinic. You can direct questions to any of our presenters today here. And we will get back to you. I want to thank all three of our presenters, ladies. You were very informative today. I hope that this has provided some great information for some of our attendees. Oh, here we go. We got one more. You said Kegels are not always recommended, but what can they help with? No need to be sorry. So Roop, that one's for you.
So Kegels, that's a very good question though. So Kegels are, they can help whenever there is actually weakness of the pelvic floor muscles. So when someone has incontinence, and you can learn specifically to learn like the muscle exercises for the muscles right around the area. So Kegel itself is a general term for the whole pelvic floor, but it's actually segmented to the front, middle, and posterior pelvic floor muscles. So that's where Kegels can be helpful if someone has incontinence issues, if someone has pelvic organ prolapse issues, if someone had hysterectomy done, or any pelvic surgeries done where they're disconnected from that part of their body and they need to relearn that reflex mechanism to restore the functions.
Perfect. There's a follow-up, and it's, can I start doing them even if I don't have a pelvic floor problem?
Yes, you can do them if you don't have any of the pelvic floor problems, but I would only do them for the awareness purpose. That means you're just doing some Kegel exercises here and there, but if you have any of urinary urgency issues, pain, or like pain with intercourse, or any of the issues where it's actually contraindicated, then I don't recommend that. But generally, if you start doing them, that's not a problem, but don't do like 100 Kegels a day. Maybe you can do 3 or 4 or 5 or 10 just for the awareness purpose, like we exercise all other muscles of our body, because these are very small muscles. They just need very little stimulus. We don't want hypertrophy in those muscles like we want in any of the muscles of our body. I hope I answered your question.
Perfect. Getting it into balance. A nice little balance. Perfect. Any additional questions? Amazing. Okay. Again, if anybody has any questions that pop up afterwards, I know there was a lot of information coming out at us for the last hour. Feel free to reach out to us. You can even DM us on Instagram. You can reach out through email. Thank you, ladies, again for presenting tonight. I'm getting all these thank yous. And then I'd like to also thank all the attendees for taking the time out of your day to come here and share your time with us as well. Thank you all. I hope you all have a good night. Bye, everyone.